Hey everyone, welcome. Today, we're diving into a really high-stakes medical puzzle, a situation where the body's own alert systems just completely fail, leading to a life-threatening collapse. And the craziest part? It all hinges on a single critical clue. Okay, so let's put you right in the middle of the action. Picture this. You're in the ER. An older woman is brought in, and she is in bad shape. I mean, she's incredibly weak, her blood pressure has bottomed out, and she's in a lot of pain. The clock is absolutely ticking. So what's running through your mind? What are the possible causes here? All right, first things first. We have to recognize just how serious this is. This isn't just someone feeling a little under the weather. This is a patient in a full-blown acute crisis. And when you look at her symptoms, they really paint a picture of a total body breakdown. We're talking profound weakness and lethargy. She can barely move. There's this awful pain in her back and legs. She's vomiting, has diarrhea. But the real kicker, the sign that has alarm bells ringing, is that hypotension. That's the clinical term for shock. This whole combination, it is a massive, massive red flag. So with a patient this sick, you don't have time to waste. You've got to find the why, and you've got to find it fast. And in this particular case, the key that unlocks this entire mystery comes from just a single sentence. And here it is. This one little piece of information changes everything. Her husband tells you she hasn't taken her prednisone in several days because she has not been feeling well. Now, you might hear that and think, okay, but for a clinician, this is a bombshell. Prednisone is a corticosteroid. It's basically a synthetic version of a hormone our body makes naturally. And just stopping a medication like that cold turkey, that can have absolutely catastrophic consequences. This is not some side note. This is the central clue we've been looking for. Okay, so with that one statement from her husband, the pieces of the puzzle just start snapping into place. The symptoms, her history, it all starts pointing in one very specific and honestly very dangerous direction. The diagnosis? It's an Addisonian crisis. It's a term for a sudden, severe, and incredibly life-threatening condition that has to do with the adrenal glands. So what on earth does that actually mean? Well, the technical term is acute adrenal insufficiency. Basically, the adrenal glands just suddenly stop being able to produce enough of a super important hormone called cortisol. And without cortisol, the body literally can't maintain its own blood pressure or manage stress. This leads directly to cardiovascular collapse. In other words, shock. It's a terrifyingly direct line from one missing hormone to a complete systemic failure. So to really get a grip on this crisis, we've got to ask why. Why would the body suddenly find itself completely out of this crucial hormone? Well, it usually boils down to two main culprits. The first one, and this is the most common cause, is exactly what happened to our patient, just abruptly stopping a corticosteroid like prednisone. See, when you're taking it for a while, your body gets kind of lazy. It gets used to this external supply, and it slows down or even stops making its own. Then you suddenly take that supply away, and bam, you have a massive deficit. The second trigger is a little different. It's when someone who already has a chronic condition, like Addison disease, gets hit with a major stressor. We're talking surgery, a severe infection, major trauma, and their already weak adrenal glands just cannot keep up with the sudden demand for cortisol. The crucial point here is that it doesn't really matter which trigger it was, the end result is exactly the same. The body is completely starved of cortisol, which is the hormone it needs to regulate blood pressure, blood sugar, and its response to any kind of stress. And without it, the entire system just spirals down into shock. Now, making a good diagnosis isn't just about finding the one thing that fits. It's also about knowing what doesn't fit. You have to rule out the other possibilities. So why wasn't this one of the other conditions that might look kind of similar at first glance? Looking at this comparison really makes it crystal clear. You see, other major crises like a pheochromocytoma or a thyrotoxic crisis, which is also called a thyroid storm, they actually present with the complete opposite symptom. Hypertension, right? Super high blood pressure. But our patient's number one key sign was hypotension and shock. That one data point alone pretty much rules these other guys out. So what about Cushing syndrome? This one is fascinating because it's the literal mirror image of our patient's problem. An Addisonian crisis is all about having way too little cortisol. Cushing syndrome, on the other hand, is caused by having way too much cortisol. It's just a perfect, if scary, illustration of how critical hormonal balance really is. The exact same hormone can cause two completely opposite, life-threatening crises all depending on whether you have too little or too much. And that really leaves us with a final thought to chew on. We've just seen the absolutely devastating impact of having too little cortisol. It really highlights the incredibly delicate balancing act our bodies are performing every single second of the day. So, if this is what happens when there's a lack of cortisol, it makes you wonder, what happens when the body has too much?